coming in loud and clear.
Perfect. Okay, good afternoon, everybody. Thanks very much for joining our weekly COVID-19 information session. As Bill mentioned, my name is Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit, and it's a pleasure to join you this afternoon and provide these updates. The format for my update is going to follow the same as our previous session. So I'll start with an update on the numbers or potentially what's happening in terms of COVID-19 activity in the region, followed by some updates around vaccination and a couple comments related to public health measures in general. And then we'll have an opportunity to discuss any hot topics that people would like to raise. So to get started, I think I'll preface my update on the numbers with a reminder that the numbers that are on our current dashboard that reflect current cases really continue to be an underestimate of what we assume to be broader COVID-19 infections in the community. And as you recall, as discussed at previous sessions, when the province changed the eligibility criteria to access PCR testing, then not as many people were able to access PCR testing. And as such, those people that don't have access to PCR lab testing are not reflected in the numbers that we're reporting for confirmed cases or for our weekly incidence rate. That being said, I think that the numbers that we do have still provide some information and are still useful to share and to follow. So to date, since the start of the pandemic, we've had 5,366 cases of COVID-19 confirmed by laboratory across Haliburton Kawartha Pine Ridge District region. We currently have 349 lab confirmed active cases or cases that have not resolved. Our 7-day weekly incidence rate has decreased over the last 2 weeks, really, and calculated today at about 254.8 cases per 100,000 people. Now, this incidence rate is, again, an underestimate of what the broader activity level of COVID-19 infection is. But I don't think we know for sure whether or not the decrease in that weekly incidence rate, how much is just an underestimate as a result of the change to PCR testing, and how much might be a reflection of starting to see a plateau. And I'll speak to that in a couple minutes from now. We have noticed a decrease in our test positivity rate. At our highest, we were up at around 21, 22% test positivity from PCR testing. And we're down to around 13.3%, which is a good decrease, certainly much higher than we have seen in previous waves of the pandemic, but lower than the provincial test positivity and lower than what we were seeing last week. So potentially one piece of that puzzle when we're looking at are we starting to plateau with Omicron COVID-19 activity in the community. I did want to comment a little bit on characteristics of cases, lab confirmed cases that have been identified in the last 14 days. So of the cases that were reported, which is about 1,078 in the last 14 days, we know that about 19.1% of those were among young adults, so aged 20 to 29, and 16% among 30 to 39. There have been 21 admissions to hospital for COVID-19 in the last 14 days. 2 of those hospital admissions were among residents of long-term care homes. 11 of those hospital admissions were among individuals that were not vaccinated. So about 52% of hospital admissions in our region among individuals that are unvaccinated. And 17 of those hospital admissions among individuals aged 70 and over. So I think consistent with what the province is seeing, that more severe illness resulting in hospital admission, largely among the older population, certainly a higher risk of severe outcomes for those individuals that are not vaccinated. And then there certainly is some risk with 2 doses of vaccine, and that decreases even further with a booster dose of vaccine. We have had 5 individuals admitted to ICU in the last 14 days, and 3 of those people were unvaccinated, or 60%. With small numbers, it's difficult to, I think, tease out some of the trends related to that. And so we look to some of the broader provincial numbers, which can give us a better sense. And unfortunately, we have had 6 deaths in the last 14 days. 3 of those deaths were associated or were residents at long-term care homes. And 3 of those deaths were among individuals that had not had any vaccine, and then 2 individuals having had 2 doses, and then 1 individual that had received their booster dose, so had had 3 doses. 5 of the deaths that we've seen have been among individuals that are age 70 and over. And so again, speaking to really what's a well-known, I guess, piece of information, that certainly older age cohorts are at higher risk of more severe disease, and again, higher risk among the population that is unvaccinated. I mentioned the piece around long-term care homes just as we start to speak a little bit about outbreaks among long-term care homes and retirement homes. So as of today, we do have 24 ongoing outbreaks in total across Haliburton, Kawartha, Pine Ridge region. 12 of those are among long-term care homes and retirement homes, and an additional 11 outbreaks among other congregate settings, which could be group homes or could be in correctional settings or correctional institutions. We are not seeing the same level of severe illness that we did with certainly the first wave among outbreaks at long-term care homes and retirement homes. We are still seeing some severe illness, so it's not that COVID-19 is always a mild disease. I think certainly older population is still at higher risk. But we do have a number of outbreaks that have seen milder illness or are only among the staff population. I think we have had some residents flag concerns related to the harmful effects of isolation among residents at long-term care homes, and the need to balance those harmful impacts against also the imperative of protecting residents against the harmful effects of COVID-19. So we did issue some interim updated guidance to our long-term care home, retirement home partners across HKPR region that looked at lowering or really increasing the threshold of when we would declare outbreaks. So really looking at our outbreaks that are only among a small number of staff. Should we consider those to be true outbreaks, especially given the background level of COVID-19 activity in the community? And then looking at certainly among homes that have seen little transmission among residents and not serious disease, how we can loosen some of the isolation precautions. This is a difficult balance. I think we still need to be aware and recognize that COVID-19 can cause serious illness. These residents are certainly the most vulnerable in terms of age and often other medical conditions. However, they're also highly vaccinated, most with booster doses, so having good protection. And we need to be mindful of really those other harmful impacts of isolation or outbreak measures associated with physical health, mental health, and emotional health. So I think we'll continue to work with our partners and finding the best way forward, and also needing to adapt as this new wave of COVID-19 has posed new and different challenges than the previous waves have. I think lots of questions around, as I mentioned before, are we starting to peak? Is this starting to level off in terms of activity with this wave of Omicron? I do think it's too early to say for our region. A couple of things that are looking promising. So one, as I mentioned previously, that our test positivity has come down, which I think is one of the indicators that we can look at. The number of outbreaks that are being newly declared each day has slowed. So we were at several days where we were seeing 5 or 6 new updates or new outbreaks being declared, and this seems to be slowing a little bit. And I think we can also look to neighboring jurisdictions and what's happening in other areas of the province. So if we look to, say, Ottawa Public Health, which is looking at their wastewater surveillance, has this really plateaued. Across HKPR, I find that we're about a week behind some of our neighboring jurisdictions. As a more rural region, it takes a little bit longer for us to start to see wider spread COVID-19 activity. So we don't tend to peak or plateau at the same time as some of these other jurisdictions. But we know it, as we watch their trends, that we will be following soon as well. So I do think that there are some promising indicators that we're quite close to peaking or plateauing, if not reaching it already. Certainly modeling had predicted that by the end of January, we would have peaked. And I think that we're still on that path, and fingers crossed, potentially a bit sooner than the end of the month. Again, too soon to tell for sure, but I think we do have reason to have some optimism and looking forward to coming out on the other side of this wave. I'll move now to a couple of comments or updates related to vaccination. So vaccination efforts do continue to focus on a couple of different priorities. Booster doses among the population that is age 18 and over continue to be a priority. I think especially among those individuals that are more vulnerable to severe disease. So that would be individuals that are older or individuals that might have other medical conditions that put them at higher risk. We have made great progress in terms of our coverage of booster doses. Among individuals age 70 and over, we're at 76.5% having received their booster dose. Among individuals age 50 and over, we are at 63% having received their booster dose. And among individuals age 18 and over, we're at 50.5% having received their booster dose. Obviously, there's always room for improvement, and we'd like to see these numbers as high as we possibly can. But I think that we really have had good response from the community. We have seen a slowing and uptake of vaccine at our clinics. We have a number of vacant appointments, and so encourage especially those that are older that have yet to get their booster vaccine dosed. To try and seek out that opportunity to help protect yourself against more severe illness from COVID-19. The other kind of hot topic group that we've been seeing certainly conversation about provincially is among vaccination among children, so those aged 5 to 11. Our coverage of this age group is at about 43.7%, and really what we've seen since vaccine was rolled out for this age group at the beginning of December, we saw very good uptake initially in the first 2 weeks or so, and then a bit of leveling off. And now it's really quite small incremental increase week by week. I've mentioned previously that those that have been working in vaccine preventable diseases at the health units have really flagged that this is not surprising, that with any new vaccine for children, really parents will be cautious and they want to ensure that the safety data is there, that the effectiveness data is there. And I think that all of the information that we have, all of the data that we have so far continues to be very positive and to demonstrate really the safety of this vaccine for this age group, as well as its efficacy. So we will continue to promote vaccination for this age group, 5 to 11. There was some announcements made at a provincial level related to having vaccination clinics hosted at schools during school hours. A couple key points here. So one is certainly that children will only be vaccinated with parental consent at school, and there are very specific consent forms that will be sent home through school boards for parents, along with information if parents have questions. we're continuing to work with our area school boards to determine what schools and what regions it makes sense to offer these clinics. We don't anticipate that there will be clinics in every single school across our jurisdiction. We know that some areas to start with have had higher uptake than others, and so we want to ensure that we're supporting those schools that might have either higher demand for vaccine or have lower coverage, and it might potentially be an access issue. I think we're continuing to try and determine how we can get accurate information into the hands of parents so they're making informed decisions about vaccination for their children. And I do continue to encourage parents to seek out information on the vaccine from their primary care provider or their healthcare provider. There is information available through hotlines through Sick Kids Hospital in Toronto, as well as provincially, so that should people have any questions, really there's plenty of people with the latest data to be able to share with parents and address any concerns that they might have. Otherwise, at health unit-led clinics, a number of clinics continuing. We have opened up health unit clinics to walk-ins for people that are aged 50 and over or have other immune compromising conditions that have yet to access vaccination. Walk-ins are during the afternoons only at our clinics, so between 1 and 4:30 p.m. We are quite hopeful that anyone that's still aged 60 and over, age 50 and over, that has yet to get their booster dose, that you'll take advantage of being able to walk into any of these vaccination clinics. If you are an adult and have an older parent or a relative that's had trouble accessing vaccine, whether it be in booking an appointment or whether it be travel to get to a clinic, please see what you can do to help facilitate them to access the vaccine. Again, we know that the booster dose is important for helping to prevent not just developing symptomatic infection of COVID-19, but in preventing severe illness from COVID-19. And so this really is a population that we're wanting to continue to try and protect. We do also continue to have a shortage of the adult Pfizer vaccine at health unit-led clinics. So this is related to the provincial shortage. I understand that a very small shipment had been received by the province, but not enough to distribute locally to health units to widen access to the Pfizer vaccine. So we do continue to reserve the adult Pfizer vaccine for individuals under the age of 30, as it's the preferred vaccine for this age group, and then offer the Moderna vaccine for individuals aged 30 and over at any of the health unit clinics, unless there's a reason why an individual would be unable to receive Moderna, such as an allergy, then we do have Pfizer vaccine available. I think those are my updates related to vaccination today, although I'm sure that if I've missed something, somebody will flag it. I did want to have just a couple of comments related to return to in-person learning at schools. So we had well, it wasn't quite a false start on Monday this week. Schools were supposed to be back at in-person learning and then had a significant weather event. So schools didn't return to in-person learning until Tuesday of this week. I think we're excited and pleased to see kids back participating in in-person learning. I know that this has caused some anxiety among parents and caregivers of children, especially given the number of changes that have been made to how we manage COVID cases associated with school settings. As I'm sure everyone's aware, there's a number of precautions that do continue in school. So this includes masking, and across all three of the school boards that we work with, there is mandatory masking for JK all the way up to grade 12. There continue to be ongoing emphasis on infection prevention and control activities, including frequent hand washing, Other measures such as cohorting, and this is for in addition for elementary school students, going back to some of the original cohorting measures that we've seen in previous waves, such as during recess, to ensure that we're trying to minimize contacts in schools. There's been a number of provincial announcements related to ventilation in schools with the distribution of HEPA filters, standalone HEPA filters for classrooms that had any indication that they might not have the level of ventilation that really we would like to see to minimize transmission of COVID-19. And then, of course, I think we continue to look to vaccination as one of our key tools, also to prevent both transmission of COVID-19 in school settings, as well as severe illness. We know that children are at lower risk of severe outcomes of COVID-19. They're not at zero risk, so there is still some risk, and I understand that certainly some parents might decide, given any risk, that they might make different decisions for their children about attending in person. And I think we've certainly seen throughout all of the pandemic response a different risk tolerance and also just different circumstances that families find themselves in. So I think the most important thing is that we're supporting children in their learning. The best place really for most children will continue to be in-person learning at schools, but really wanting to support all families and all children to get back to or continue the essential work of education, and support our education workers and childcare providers that have continued to manage throughout all of the pandemic and ensure that they have the supports that they need to be comfortable in going to work and to continue to support the education and care needs of our children. So I imagine, I know there's continued to be lots of discussion, and I think we'll see how this week goes and next week goes. Hopefully with the potential plateauing at community level with COVID-19 transmission, we'll be able to resume some other levels of normalcy within the education system as well as broader community. So with that, I think I'll end with our usual reminders to continue to encourage people to follow those basic public health measures. I know I sound like a broken record, but to continue with the masking and have those well-fitted, tight-fitting masks, especially indoor places and especially places where you're not able to distance. To follow the provincial regulations related to restrictions and gatherings and other limits for other sectors, and vaccination will continue to play that very important role in moving us all towards greater immunity to COVID-19. So I will stop there and happy to answer any questions to the best of my ability today, and looking forward to the discussion. So back to you, Bill.
Thank you, Dr. Bocking. Normalcy, what's that? Actually, I'm not a reporter, so I won't ask the question, but maybe I can hint to one of them. I'm going to turn it over. If reporters have any questions, you can raise your hand or use the chat box. The first question we have is from Lee from Moose FM. Lee, if you want to unmute and just ask your question.
Thank you. Hi, Dr. Bocking. Just talking about the walk-in clinics. So is it a case of you have a lot of doses of vaccines, but not a lot of uptake right now that you're opening it up for walk-ins?
So is one of the reasons. I think there's a number of things that we consider related to kind of capacity of staff to manage lines, because we don't want people waiting indefinitely, but certainly one of the reasons we moved to walk-ins is that we were seeing more open appointments, which frees up our staff to be able to meet the needs of walk-ins and not have them waiting for long periods.
Mm-hmm. Okay. And how long is this going to go on for? Do you anticipate this going on as long as you have these open appointments?
So I anticipate this is going to follow a similar trend to what we saw this past summer as we rolled out second doses of vaccine. And we see this also across I think, almost every health unit in the province. So you reach a point where uptake for appointments slows down. So you start to open up more to walk-ins. And then as you open up more to walk-ins, you maybe start with one age group and then you open up broader to all age groups so everybody can walk in. And then if we're not seeing the same uptick, even with walk-ins, then we start to move towards more mobile clinics. So it's I think, a very similar strategy that we'll start to see that we're also seeing across other health units in the province.
Thank you.
Thanks, Lee, for that question. I'm going to turn it over now to Dan from the Scugog newspaper. Dan, go ahead with your question.
Thanks, Bill, and Dr. Bachman, as always. First off, you mentioned the potential timeline for peaking this current wave of Omicron. I guess with the reduced level of community testing, I guess how will we know for sure when this wave has peaked?
So there's not one indicator, I think, that we'll know for sure. It will be the picture of a number of different indicators. So I mentioned test positivity being one of those. Certainly the rate of new hospital admissions is also another indicator. Wastewater surveillance. So some other jurisdictions are able to have a daily updates with wastewater surveillance that is able to inform some of that. So there's a number of indicators that I think we'll use all together, and it will be the type of thing that we look to see if there's a trend. So the first day that there's a kind of lower counts, we don't want to assume anything at that point in time. But I think once there continues to be a steady, its test positivity continues to remain low, hospital admissions, then we can start to say with more confidence that we have plateaued in this wave.
Okay, thanks. Yeah, and recently as well, the antiviral pill was approved by Health Canada. I was wondering if you want to maybe speak to that and its importance in the battle against COVID.
Mm-hmm. So it's definitely a much welcomed additional tool in our toolbox. I think the intent of that antiviral pill is to prevent severe illness from COVID-19. And so this will be very important in helping to hopefully prevent ICU admissions, potentially help prevent admissions to hospital. So it will help to mitigate really the burden on our hospital system, our healthcare system. Now, it certainly doesn't prevent COVID-19 infection. And so it doesn't mean that we should focus less on those tools we know work to prevent COVID-19 spreading, which would be vaccination, masking, other public health measures. But in terms of measures to help decrease the burden on our healthcare system, this is going to be very important.
Okay, great, thanks.
Thank you, Dan, for your questions. Next up, we have Sue from the Times and Echo newspaper. Go ahead, Sue.
Thanks, Bill. Hi, Dr. Walking. Today, I wanted to ask about hospitalization because we talk about it a lot. We talk about the numbers we're seeing for hospitalization, but we don't always talk about what that actually looks like. So I think that most of us believe that it's often related to respiratory distress, but is that what you're talking about, or are there other instances in which people are hospitalized with COVID for other things that you're seeing?
So that's a great question, Sue. And I don't have the details of the kind of the actual presentations of cases admitted to hospital across our region. I do know that there is a kind of spectrum of ways that people might present to hospital. So certainly respiratory or breathing problems is definitely one component. But other reasons include things like dehydration, could mean be heart problems associated with it. We know that having COVID-19 infection puts someone at higher risk of having a heart attack or developing a blood clot, so complications related to that. or heart arrhythmias if the heart's beating in a different rhythm. So there are a number of other ways that COVID-19 infection might cause someone to become ill, other than just I think what we assume to be breathing problems, coughing, needing to go on oxygen, and then potentially a ventilator. I think the most common still is the respiratory component or the breathing component, but it's not the only component. I think the other thing I'd flag related to that is especially among the extremes of age, so individuals that could potentially be in their 80s or 90s and have a number of other medical conditions that they might already have. COVID-19 infection might present mainly even as weakness, fatigue, which ends up resulting in not eating as well, or a higher risk of falling and injuring themselves, or other kind of problems that result from their other medical problems being exacerbated by this COVID-19 infection. Not sure whether or not that was what you were looking for or if that's helpful, but a bit of, I guess, more of my clinical understanding of how it might present.
No, that's excellent. And further to that, if somebody has tested positive, or if they haven't and they suspect that they have COVID, at what point should they consider going to the hospital? Because some people might think, oh, this is a rough spot, but I'll get through it, when they should go to the hospital. And some people, of course, might go to the hospital when they don't need to at that point. So at what point do people know that this is it, I should be on the way?
Right, really tricky question, and because really the same question could be asked for any illness, whether it be flu or even the stomach flu. At what point in time really are you sick enough that you should be going to the hospital? I did want to point out that both Northumberland Hills Hospital, Ross Memorial Hospital have set up their assessment centers now have been adapted to be really more clinical assessment centers. So if individuals are even unsure whether they're sick enough that they should go to emerge, certainly if you're having trouble breathing, if you're having trouble doing your day-to-day activities, if you're not eating, you're worried you might be getting dehydrated, chest pain, really you can seek out an assessment at the clinical assessment center, and they'll also be able to give you an indication of, really you probably should be going to emerge, getting a more thorough assessment. I do one caveat. I mentioned chest pain. I think chest pain is one of those common, if you're experiencing chest pain, should be going to emerge regardless to be investigated and get that initial workup. But I think there are tools for people to, even if you're starting to have an inkling, to reach out, whether it be telehealth, your family doctor, primary care provider, or these clinical assessment centers, to don't wait, to have an assessment, talk to somebody, and then if they're concerned at all, they'll make sure to be directing you to the emergency department. Absolutely, COVID-19 is not just a mild cold for a lot of people. And so I think if you have COVID-19 and you're starting to feel more ill, don't assume that it's just going to get better and go away. If you're feeling really ill, you should seek a healthcare assessment.
Perfect. Thank you.
Thanks, Sue. I don't see any other questions or hands up. Do we have any questions from those attending? I see Sue has her hand up again, so there being no other questions, carry on, Sue, if you want to ask another question and follow up.
Thanks so much. My other question is about the potential for drive-through vaccination clinics. I recognize that we are in winter season, but I'm just wondering, I know that in Ottawa, a doctor actually did it individually at her clinic for children with complex medical cases. And I'm not sure if it might be something that would be of value for people who do have mask exemptions and don't want to go inside, or might just appreciate the convenience of being able to drive through. Is that something that we might offer again, even though it's winter?
Even though it's a little bit chilly, hopefully not during a snowstorm. And so I think at this point in time, we don't have any drive-through clinics scheduled. we are kind of reassessing the whole landscape of vaccination clinics again and looking at what other avenues to try as we see uptake slowing at our existing mass immunization clinics. We had offered drive-through clinics in some other rural locations back in August, and I think we'll be reevaluating and looking at that again. At this point, we don't have anything scheduled, but I will take that back to the team and be looking with our partners at what's feasible.
Thank you. And sorry, Dan, I have one more question, if that's okay, just to squeeze in. I just wanted to ask as well about the mask exemption at school and masking policies. I recognize that you're not part of the school board, but I know you are working closely with the school board. So I'm just wondering what that looks like for parents. At what point should they consider a mask exemption for their kids? And what is what would they need to do in order to bring that forward to their school? I don't know if that requires a medical note or something further.
Yeah, so it's tricky. It does vary by school board in terms of what their requirements for documentation for a mask exemption at school. I think most school boards do now require some form of healthcare provider documentation or note to support that mask exemption. But you'd have to look very specifically. Certainly the principal of the school would know what documentation would be required for that particular school. There really are not that many reasons why a parent should be concerned that their child needs a mask exemption. Certainly, there are some reasons, and I think parents with some children with special needs are probably most familiar with this. But there might be other anxiety or I guess mental health reasons why a child might struggle with a mask, and those are really the majority of reasons, not a lot of other reasons from a physical medical perspective why an exemption would be required.
Excellent. Thanks so much.
Thanks, Sue, for those questions. We have Dan back again, so please ask your questions, Dan.
Thanks. Just one more question. You mentioned last week about, say, hearing some hesitancy towards the Moderna vaccine. I'm just wondering if the health unit's still noticing that same hesitancy from people this week. It does.
We are, Dan, still noticing the same hesitancy towards Moderna. We, I think, continue to share information about the Moderna vaccine if people have questions. Still seeing about the 10% either no-show rate or decrease in appointment booking. Although I think that there is a part of the community that might be waiting for the shipments of Pfizer vaccine to come. I think the challenge with that strategy is we don't know for sure when those shipments of Pfizer are going to come. What we do know is that the protection that a booster dose offers is needed now and not 3 weeks from now or 4 weeks from now. So I would encourage those people that have not received their booster dose and are still wondering Moderna versus Pfizer, that Moderna is a very effective vaccine for booster dose, and I'd encourage people not to wait for Pfizer to become available.
Thanks, Dan. And I guess I'm going to open it up again. Are there any further or final questions from members of the media? I think when we talk about measurements of COVID and interest, we can also maybe use a measurement of the number of attendees to these weekly media information sessions, because they certainly ebb and flow with the virus. So some great information as always, Dr. Bocking. Thank you for sharing it. Thank you to members of the media and others who have attended. We appreciate your help in spreading the word, not the virus. We will be back again in 7 days' time, same place, same channel. And I see, just before we go, that's everything. So again, thank you for your time and participation. We'll see you next Wednesday at 2. Thank you, Dr. Bocking. Have a great rest of the day.
Thanks very much, everyone, for joining. And Bill, if it's just you and I next week, we'll know that COVID's no longer a hot topic.
we've hit peak, and I guess we're plateauing. All
Yep.
good.
Great. Thanks very much. Take care, everyone.